Hello everybody, my name is Ryan Osborne. Today we're talking about hemophilia on the Genetic Disorder Show. So when we're talking about hemophilia, we might want to start with how many people have the disease. In the United States alone, 40% of the entire population have the disease. That means these 4 people out of 10 people have the disease hemophilia. Poor blue, poor green, poor orange, and poor purple. So what hemophilia does to you is that you don't scab or your blood doesn't clot when you get a cut or a paper cut or any kind of really cut and you wear, any kind, should we say. It's also called the royal disease because that Queen Victoria was once a carrier and her daughter died at an early age from having the disease. So the person who found the disease was Dr. John Conrad after reporting a woman who had all the symptoms of hemophilia, which is actually highly ironic because men have the most cases in the whole world right now, and named the disease hemophilia after the root word hemo, which means blood in Latin. So the place that has the most cases of hemophilia is Africa, with a whopping 79% of all cases of hemophilia are in Africa, which actually causes the most AIDS in Africa also. Some signs and symptoms of hemophilia are really bad neck swelling and joint swelling, also really easy bruising and just very soft tissue, which can cause easy bleeding, which also can cause easy death. Here are some examples of the really bad swelling in the knee joints and really easy bruising around the body. Hemophilia is mostly inherited by the mom, and which is shown by the mom right there. So hemophilia is a codominant trait and also a chromosomal disorder, which is a cool picture with the codominant snake. Hemophilia is in the X chromosome in the F8 section of that chromosome. So here's an example of how hemophilia is inherited. So the dad has hemophilia and the mother doesn't, and they have 4 children, and the daughters are carriers of the trait now. Hemophilia has to be medically diagnosed and by blood test to test the clotting factor of the disease. So the average age of a person with hemophilia is 74 years old, which is 10 years younger than an average normal person. So that's still a really good age as long as they take the treatments and avoid sharp objects. So the way that we actually treat hemophilia is by aminopropic acid by injection or mouth. Also some self-treatment methods are some tranexamic acid by mouth or Lestida.